Good morning, Dr. Volk. Thank you very much for agreeing to be with us here this morning. It's very much appreciated. I believe we're both vaccinated and fairly distant, so if we remove these, we should be okay, so it's a little less muffled in our conversation.
Sounds good.
The first thing I wanted to ask is, so what do you envision for the CAP in your next 2 years?
What I intend to focus on in the next 2 years is continuing our diversity, equity, and inclusion work. We still have a lot to do, both from the staff perspective and the member perspective. My focus will be mainly on the member perspective, and I know Stephen Myers will be focusing on the staff perspective. We want to make sure that everybody who wants to join the college, is qualified to join the college as a fellow, feels welcome here. This should be everyone's professional home who's a pathologist, board certified, and willing to participate.
That sounds excellent. I look forward to seeing and hearing more about that. And so, what are some key challenges facing pathologists right now?
You know, I think the pandemic has challenged everyone, right? So I think pathologists are, we're people first. And, our families have been, faced with all kinds of issues around having to do school from home, having to change from in-person sign out to remote sign out. If you're at a teaching institution, having to change from being at a multi-headed scope to connect with your residents versus having to figure out another way, maybe using digital pathology again to help facilitate that connection. The other thing I think that we've been challenged with is bringing up a test really, really fast and then doing it well. And I think that this college has been so amazing, and the members have been so amazing in responding to the call for accurate, safe, reliable COVID-19 tests. And how wonderful that we all were able to come together and provide that for really the world.
I agree, and I do have to thank the CAP. My institution is very large and brought a lot of COVID in, and you guys definitely were helpful in helping us navigate that, so thank you.
Well, aren't you proud of us? I mean, I'm so proud to be a pathologist right now. Even though we're faced with this hardship with the pandemic, and we hope that, we'll see some light at the end of the tunnel soon. Just noticing how everybody stepped up. Mm-hmm. We figured out how to navigate, again, how to navigate going to work safely, how to navigate doing frozen sections safely to support essential surgery, and then how to bring up a brand new test and do it well. It's awesome.
It was. We definitely rallied as a nation for
Absolutely.
that. As a nation.
Absolutely.
And then particular maybe to advocacy and some of the new changes that are possible coming up in the billing or payment. What thoughts do you have about that?
Well, again, never waste a good crisis. So because pathologists were really at the vanguard of the pandemic and finding solutions for patients, I think that pathologists have caught the eye in a new way for those folks who make policy, our lawmakers and so forth. So this just positions us even better for them to hear us and hear our concerns around patient access, appropriate reimbursement, surprise billing issues, and so forth.
Exactly. So they can understand what we do, which we know is often an issue sometimes. So how would attending the 2022 Pathologist Leadership Summit in the spring help us address these issues?
Well, first of all, I'm so glad you brought up the Pathologist Leadership Summit. It is one of my favorite things that I get to do as a fellow of the CAP, and that is to advocate on behalf of our patients and our profession directly with our lawmakers. To me, as an American citizen, exercising our full rights to representation is awesome, and the CAP makes that easy. So as a member, the Pathologist Leadership Summit is a benefit. It doesn't cost anything to participate in the Leadership Summit. How wonderful, right? Mm-hmm. And the staff in the Advocacy Office and the Communications Office in Chicago and Washington, D.C. together help pathologists bring the message to our congressmen in a way that they'll hear us, in a way that makes some of our technical language that we're very comfortable with easier for them to understand, and it makes us better communicators and more effective advocates. So the Pathologist Leadership Summit is a wonderful experience that even when we do it virtually, we can connect with our lawmakers. When they know their constituents, when they can put a face and a name to a constituent in their district and build a relationship, that is how things get done in Washington, D.C. So I just can't say enough good things about that experience, and hope that everyone who can joins us, either in person if that's possible, or virtually if that's the other option for them.
I know myself, I have gone, and I feel that I've learned so much from the sessions we have, and then, hopefully can give back by having those conversations. I'm going to pivot a little bit. What advice would you have for somebody who is newer in practice or soon to be in practice?
I think one of the most important things that I needed to understand early on in practice was to know what I didn't know and be comfortable asking for help. I think as high achievers, which most physicians are, we sometimes think that we shouldn't have to ask any questions. We shouldn't have to get help on what one would think is an easy specimen, right? Especially in your first year of practice. It turns out, in my first year of practice, it was those hernia sacs and those little colon polyps that, even though I had done some research work in colon polyps as a resident, I still wanted somebody else to take a look and make sure I hadn't missed anything. And so being able to reach out to my colleagues in my first practice, and continue to reach out to my colleagues now 20-some years into practice, makes me a better pathologist. It makes me deliver a better diagnosis for patients, and I feel like I've got the confidence and the expertise that I need. And so pathology is not a singular sport. It is a team effort. And it's good to use the expertise of everyone that you're working with in your department and not feel shy about that.
That is excellent advice. We have a daily consensus, and I call it using the hive mind for a diagnosis.
Oh, I love that.
Like, I need the hive mind. So that's excellent advice. Thank you. And for any medical students that might see this, what would you like to say to them?
I would just say, first of all, pathology is a specialty that you can go into. And it's a specialty that covers all parts of medicine. So you don't have to choose between surgery or medicine. You can do it all. And you can work with surgeons, you can work with internal medicine doctors, and you're touching so many patients. Frankly, I think pathologists have the opportunity to touch in quantity and quality the most number of patients. So if you are interested in the truth, and you're interested in actually seeing what is happening with the patient, getting to stare the enemy in the eye every day, go into pathology. It's very exciting, and by the way, pathologists are pretty nice.
I was going to say, I know I enjoy what I do. So, well, thank you very much. I appreciate you taking the time out of your day to answer some of these questions for us, and look forward to the next 2 years.
Thank you. It's been a pleasure.